Public and Community Health by Leslie Buchanan. Illness does not discriminate. It affects the poor, the wealthy, the young, and the old. Despite efforts to ensure Americans have health insurance, access to health care is sometimes difficult and limited for many people. Proper medical attention, containment of diseases, and promotion of a healthy lifestyle is essential to achieving healthy outcomes. Even though many Americans have insurance, public and community health is a necessity to ensure the indigent, elderly, and mentally ill population receive adequate health care and the general population is protected from outbreaks of disease. Community and public health plays a vital role in the well-being of the general population. An important step in ensuring the well-being of the general population is in identifying and solving health problems. Under this service, emergency response teams at various levels of government, as well as non-governmental agencies, monitor the activities surrounding potential harms to the United States. The harms under surveillance include threats of terrorism, as well as weather and natural disasters. Identifying problems is done through a thorough assessment. Educating the public is accomplished through effective communication. Communication methods vary depending on the issue. The mobilization of teams provides the public with resources and supplies. Policy development is a process accomplished through new policy development and continuous revisions of current policies. Public safety is achieved through enforcement of laws and regulations. Access to care must be available and is even more important during a crisis. The competency of healthcare workers will ensure consistent and effective care is provided. The evaluation aspect helps eliminate errors and change processes. Research allows insight into new opportunities and methods of improvement. The role of community and public health promotes a healthy nation of people. Emergency preparedness is a critical element in how public health responds to disasters. Disasters can be natural or man-made, whether intentional or unintentional. In the event of an emergency, it is local government that responds first. If local government requires help, state government is next to respond, then FEMA, then the Department of Homeland Security, and then the President of the United States. Ethical challenges exist in public health initiatives because it can sometimes interfere in freedom of choice. Interventions initiated by public health can be viewed as intrusive to the general public, but are done so for the greater good of the people. Funding for the public health systems is provided through the federal government. The Social Security Act in 1935 included provisions to provide grants to states for public health, and in 1964, Medicaid and Medicare was established to fund health care to the poor and the elderly. There have been recent declines in funding of the public health system. Health care based on need, not preference, could relieve some of the financial burden that states have to provide basic care to Medicaid beneficiaries. Availability of preventative health services is important to health outcomes, such as for individuals with chronic illness. Preventative care is proactive health care and saves money in the long run. Treating diseases is reactive care, and the cost of this treatment can be very expensive. Communication is not just relaying a message. Effective communication involves how the message is being delivered. In times of crisis, the message must be delivered in a way that does not promote panic or fear in the public. Emotional response could interfere in the information one retains. Information needs to be clear, precise, and easy to understand. The protection of the public could be at risk without communication. Whether for promotion or protection, communication plays a vital role in public health. Emergencies, illness, contagious diseases, preventative care, and healthcare access are a few of the problems that public health agencies deal with on a daily basis. Insurance coverage does not safeguard the public from all potential health threats. Public health has essential core functions that help to protect the overall well-being of the general public. It is the goal of public health to promote and protect the life of all individuals. It is the hope and intent for public health to ensure all individuals have the ability and opportunities to have a healthy mind and healthy body. Thank you, and these are my references.